All right, the president revisiting an issue he touched a lot of controversy with yesterday, the use of hydroxychloroquine, saying that he was not fairly characterizing it, and a lot of his medical supporters said it was misinterpreted. What is not misinterpreted is that there have been at least 4 prominent studies on the use of hydroxychloroquine for other issues beyond lupus and malaria, for which it's more popularly used and for which there have not been any real noteworthy problems. The issue here is whether it is advisable to take to ward off COVID-19, and no less than the Food and Drug Administration had warned back on April 24th that hydroxychloroquine and chloroquine have not been shown to be safe and effective for treating or preventing COVID-19. And still another study by the New England Journal of Medicine, this one a Columbia University task force that looked with the Irving Medical Center at some 1,300 patients taking hydroxychloroquine as a way to ward off COVID-19. 60% of the patients who received hydroxychloroquine for about 5 days did not show any lower rate or risk than those who did. So the bottom line, if this was supposed to be a remedy for hydroxychloroquine, there was no statistical evidence of that. The study that looked at veterans, the VA, there was a study that looked at them and the vulnerable population, several of whom died taking this. Now, it has been dismissed as saying that this was a rigged study, but it did show that those with vulnerable conditions such as respiratory or cardiac issues ultimately died. Now, statistically, it was significant enough to show in that population of those taking it, it did no good, and in some extreme cases, killed them. There are at least 5 other studies out there. None of this is to say that hydroxychloroquine it can't be used for other uses, namely malaria and namely lupus, its 2 most prominent features. As a preventive, though, when the Food and Drug Administration itself is saying it's not advisable, and out of clinical trial basis is risky to do, that should suffice the argument right there. But again, this is just only come up again because the president was raising it again, responding to questions as to whether it might be premature for White House physicians to allow him to take it. I want to get the read from Dr. Martin Makary on this, the Johns Hopkins University professor of public health. Doctor, we're revisiting this issue again. And what are your thoughts on this and the president taking this as a possible, preventative to ward off COVID-19 or at least prevent its onset? What do you think?
Well, we were all hopeful that there would be something there, Neil, and many doctors in Italy and even some in the United States took it prophylactically. But the data has accrued now, and it simply has not shown any benefit. If you look at clinicaltrials.gov, which is our national registry of all ongoing clinical trials, not just in the U.S., but worldwide, there are over 40 trials using hydroxychloroquine, none of which have yielded a positive result. And many of the ongoing studies have interim analyses which have not reported out a positive benefit. And we know there's a downside of arrhythmias. So I think many physicians have stopped recommending it. Many physicians who took it prophylactically stopped taking it. And when we look back at the early enthusiasm, it was around a French study that said there was a 70% cure rate in 20 patients. Well, the original group was 26, and 6 of those patients were either lost to follow-up in the ICU, and 2 of them died. So it really was a poor study.
So let me just be clear here. When you talk about those who took this who noticed no statistical difference, what does that tell you, especially when the president did mention that thousands of people on the front lines in this battle against COVID-19 are taking it? Do you know that to be the case? Is it just an insurance policy? How would you describe it?
Well, we know in Italy it was talked about a fair bit among the physicians in their physician communities. We know that some doctors in the United States took it either if they got sick or even some prophylactically, a minority. But by and large, the scientific process has worked here, and there is no data to suggest that it has any benefit, and their harms are well recognized. So that's where we are right now.